الماني أصلا.
Let me tell you a little bit my story. First, my first profession was an engineer. So I was engineering. And I was sent to Israel for a research project.
Nothing
Working
يعني
with
إسرائيلي
lasers.
with us, for us.
And I had an accident. An accident where three of my fingers, right hand, were cut off in two pieces. Luckily, they could fix this very nicely. They put nails in to hold the fingers together. But when I came home, I had a problem. And the problem was the bones didn't want to melt together. I had pain and problems with blood circulation. I saw, being at home, all the experts you can think of. All of them said the only solution they had was to take off your fingers. They had no solution. As an engineer, you have a problem and you have a solution. But I didn't have a solution. The only one was taking off the fingers. So in my desperation, I saw a friend of mine, he became a naturopath, and he prescribed me, number one, a liberal homeopathic remedy, actually calcium historicum in a certain potency, C6 for the homeopath, which helps to melt the bone together. Is the acoustic good? Can you hear me now?
Yes.
Yeah, okay. So after 2 weeks, you could see the bones starting to melt together on an X-ray. Unseen in normal medicine. He gave an ointment, Hypericum or Sanctions World. I applied externally to improve blood circulation. So blood circulation improved. And then he looked in my eyes doing iridology. As an iridologist, you would have a magnifying glass or a microscope and enlarge the iris. And from there, he told me basically within a fraction of a second that I had a lower back problem and I had a chronic infection on my left ureter. And I don't know, I didn't understand how he could see that within a second. I didn't tell him about my health issues. So I was very impressed. Number one, I got my fingers back. Nails could be removed after a couple of weeks. I got a full feeling, no pain, nothing. So then I started to study natural medicine, reflexology, homeopathy, acupuncture, went to the library, read all the books day and night. I was fascinated. And then I thought, well, if a doctor can't help you with a relatively simple problem, then for my own safety, for the safety of my family, I should become a naturopath and study. And that's what I did. I didn't intend to practice. And I want to give you a warning right now. Studying natural medicine is highly addictive. So once you sign up, then you can't stop. It's a fascinating subject. So I didn't intend to practice. But I thought, well, let's get some knowledge to be able to help yourself. But at the end of the training, I bought a clinic in Germany and started to practice full time. So lots of people. And then after some time I was invited to give lecture presentations. And I wrote a couple of books and articles, was on radio, TV, etc. in Germany. And then I started my own college. One college. I had more colleges than I had at the end. 13 colleges all over Germany. And I was was married at the time. My wife wanted to go to England. So, as I'm a good husband, I followed my wife. So I moved to England. Also, I want to expand my education and training, etc. So I moved to England. Started from zero, one college in London. Now, as you know, we have 10 colleges in the UK, in Ireland, and we just out of the college last year in Dubai, now in Kuwait. Who knows what's happening in Kuwait? Okay, so that's my story. Now, let's have a look at our training. So we have been practicing, or we have been teaching natural medicine in the UK for 26 years now. It was hard work, I can tell you. It was not easy. We are the leading training provider in the UK, in Ireland, the largest training provider in Europe. We constantly improve the quality of our training. We have now, as you can see here, that's where we are in the UK. We have about now 14,000 students taking our diploma courses, degree-level diploma courses worldwide. If you add, many students are doing short courses, mini courses to warm up, if you like, or get some basic understanding. So if you add all of those, we have at any time about 13,000 students studying our training. And we have a couple of students and graduates from Kuwait too, believe it or not. One of them is sitting down here. And there's another one, I think, yeah, in the back, studying at the moment. I met some other students. Here's another one. Anybody else who's studying? Oh, beautiful. And you do, wow, there are more than I thought. Beautiful, wonderful. We should have a meeting. So you're all studying online, obviously. Very good, excellent. All right, so let's have a look what we offer. We have degree-level courses in nutrition therapy, which takes about, the diploma course takes about 2 to 3 years. You can top up if you have done our diploma course, or start straight away on our degree course, BSc, which takes about 3 to 4 years, depending on how intensive you study, full-time or part-time. Then we have a brilliant training in herbal medicine, so the video just now, which takes about, depending on how you combine your modules, 3 to 4 years. Okay. Same applies to acupuncture and homeopathy. Training takes about 3 to 4 years, or some take 5 years. We have 2 other interesting diploma courses which takes about a year, offered online as well as in class, which is the Master Chef and the health coach. I'm living in Florida. America for me is a third world country. Why? Because they don't have food. They don't have food. But they are like big bodies. Where's it coming from? From junk food and sugar and I don't know what. And then I thought, well, we need to start from the basics. Teach how to cook, how to prepare food, how to combine food. And that's why we developed the Master Chef training. I developed in Florida with Bobby and other guys, also health coach training. Right. Now, let's have a look. Whatever training we offer, we follow naturopathic philosophy. Now,
take this photo and
what is
send
the
me WhatsApp
naturopathic
now.
philosophy? Number
It's here also,
one,
here.
we recognize
Here.
that the body has vital force. We can call it chi or prana. This vital force can be stimulated or suppressed.
Yeah.
So, in other words, and this is important to understand. So, we have a living organism. We use a living organism, our body. There's energy there. And if the energy is out of balance, it needs energy to bring it back to balance. That's a very important, basic understanding one should have as a naturopathic practitioner. So, what is energetic medicine? Energetic medicine would be food, organic, whole, energetic food.
6652.
It's not microwave food,
6652.
what they have in America. It's not food prepared on an induction heating. So it could be organic and whole and all of that. We talk about nutrition a little bit later. But we use also herbs or acupuncture, energetic therapies. The body is out of balance, the energy is out of balance, so it needs a particular energy to get it back in balance. You can't do this using drugs. Drugs are needed, are important, there's absolutely no question, they're happy to have them. It's taken too often, too much, in my opinion. But if you want to be, my opinion, my experience, if you want to be helped and healed, you could apply energetic medicine. No matter what it is. It could be acupuncture, doesn't really matter. Or reflexology, energetic medicine. Problems you have been dealing with before. Very often the problem followed by suppression would be asthma, allergy, candida, that I even have bellies like. It's very often based on candida in your digestive system. All right. So that's number one, what we need to recognize. The body has a vital force. This vital force can be stimulated or suppressed. We try to stimulate it, we try to balance it. We also know, and that's another important thing, the body can heal itself if you give it a chance to heal itself. Sometimes it needs, what I mentioned before, energetic medicine as an impulse to get the body back in balance. So that's where we come in as a practitioner, to help to support the body to heal itself. But the body can heal itself, no matter what it is. In principle, there's no disease where the body can't fix itself. So that's something which needs to be understood. Then we try to find the cause, the root cause of this of a condition. We would not consider a symptom as the disease. Let's say somebody has a high blood pressure, low blood pressure, migraine, headache, allergy, you name it. These are all symptoms. It's not necessarily the disease. The disease is somewhere else. Cancer, in naturopathic terms, would be a symptom. Somebody developed cancer for some reasons. Cancer can be developed within a short period of time. Most of the time it takes tens of years to develop. So there's a history to it. The history is very often based on wrong food, wrong environment, wrong whatever. So what we try to do in natural medicine, whether it's nutrition, herbal, acupuncture, homeopathy, we try to stimulate and strengthen the individual the individual immune system, the self-healing mechanism of the body. That's what we try to do. And sometimes we are normally very successful with that. All right. So in other words, the question for us is not what is the disease, why is it there, and where did it come from? We focus on the person, not at the symptom. All right. All right. I'm sure your diet is pretty good, I hope so. Not too much sugar, not too much coffee. Alcohol, thank God, you don't have it, so you stay away from that. We have drugs, we have alcohol, we have all sorts of things. That's the reason why people develop chronic conditions. But what we have in this country is too much sugar. Sugar everywhere. Sugar is poison number one. So you've got to reduce it or delete it from the diet as much as you can, including synthetic, artificial sweetener, etc. It's a cellular poison. You need to look at the body as accumulation of cells. Obviously, it's a kind of batteries that communicate with each other. They create an energy flow. Now, if you add poison to your body, then this energy flow is somehow blocked. The person is less alive. The functions are less functioning. I hope you understand what I mean. Okay, so got to stay away from this toxic stuff. I've been traveling in a taxi yesterday, and very often have in taxis artificial what's called air pressure. It's a damn poison. Normally I talk to the taxi driver and say, get this thing out. You can't have it. If I go in a hotel where they use such things, I move out. I can't inhale this every day or throughout the night. It's a poison. So you need to get out of it. Right? So these are small things. And in the Western world, as I hope not so much here, people are sweating on the armpits, etc. When they use creams and sprays to stop it and block it and suppress it. Now, in natural medicine, very often when we welcome a client, we shake hands, we say, oh, the person is sweating. Maybe he's smelling. Now, if somebody is sweating, it is a symptom representing a certain condition. And that's what we need to understand, depending on the smell, depending where one is sweating. You can smell basically the disease or the condition that the person is in. I had once a client coming to my clinic in Germany. My secretary said, oh no, I had to open the window, it was really stinky, like strong smell. I said, oh, that's beautiful. I could smell the kidney dysfunction. So you could smell the disease. Is that beautiful? So all I did is basically give the person a remedy to support kidney function. And after a while, the smell stopped. Or people are sweating in the armpit. Now, the worst thing you can do is use this poison to stop the smelling and the sweating. What you do basically, so the body tries to get rid of toxicity. And now you come and say, I push it back, the stuff, and I add to it more. You can't have it. The main reason why women, especially in America, not women, men in America develop breast cancer is because of antiperspirant spraying like day and night. So in Chinese medicine, herbal medicine, nutrition, we understand where this sweating, especially in the armpits, are coming from. It's related to liver function or cardiovascular problems. So you strengthen those organs and the sweating will disappear. But you've got to understand the cause, the reason behind it, and address the reason behind that. All right. So let's have a look at the next. Yeah. The body is energy. And as I said, it needs energy to be alive. And one of the key nutrients is water. There was a scientist in Japan, Mr. Masuro Moto. He took water crystals or water drops on the electronic microscope, magnified them, and what he could find out that pure water, energetic water, has such a structure. Toxic water, which is more, I believe, in the Western world, toxic water loaded with chlorines, other toxicity, are not weighted, are not energetic. So those waters are very energetic. So they support your life energy, your chi, your vital force. So that's why you've got to drink clean water. So how do you go about it? I purify water at home. I fill up a glass flask with water, add some lemon to it, maybe a crystal, like a quartz crystal, put it in sunlight to absorb the energy from sun, and you have energetic, clean, beautiful water. And that's what the body needs. The body doesn't live on sewage water. It needs clean, beautiful water. Especially if you're dealing with chronic or very sick people, cancer, etc., etc. You want to make sure you feed the best food possible. Organic food, organic drinks, whole stuff, and clean, energetic water. And I go even further. I had recently a cancer patient. So, as a naturopathic practitioner, you sort out diet number one. But also you sort out clothes. Talk about energy. Whatever, you could understand that whatever you wear could support your energy, or it could soak and absorb your energy. And when I'm talking, or what I did with this client, I said, well, all your underwear, whatever is attached to the body, could be a natural fabric. And I can demonstrate this in a second how it works. Could it be a natural fabric? Why? Because synthetics does rob your body of energy. I can demonstrate this in a second if you like. So that's key. That everybody should wear, especially on clothes attached to the skin, use natural fabrics. So it could be silk, there could be cotton, there could be linen, whatever's used more, especially at night. You know, your pyjama, whatever you have, got to have a natural fabric as well as your bed sheets. Especially, I'm always recommending silk. There's a therapeutic effect on silk. Somehow it has a positive effect on menopausal women sweating at night like normally like hell, etc. So you've got to get silk bed sheets or silk blanket, and the sweating would alone by replacing your bed sheet to natural fabric, in this case silk, the sweating would reduce. It's very interesting. Yeah. So if we deal with difficult patients, we sort out lifestyle, food, and then add whatever you practice, soul medicine, homeopathy, acupuncture, whatever it is, and then somebody can recover, has a chance to recover. We have actually a couple of our students, and I think you can read this on our website. They couple students, they had cancer and that baby had themselves. So in other words, there's always a possibility, there's also a chance. Suppressing symptoms is not necessarily a solution. All right, so I thought I share this with you. Now, let's talk about the nutritional therapy training. So as I said before, it takes 2 to 3 years. You can top it up to a BSc, which takes another year. And we always start, whatever training we have, we start with biomedicine. Biomedicine meaning
You took the previous one?
you study how the body works, anatomy, how the body functions, physiology, and about disease. So we cover one organ system at a time, bring this all together. We study how organs work together, how they are interlinked, which is important to understand. And we do laboratory, etc. As well. Understand, people are coming with a blood test or urine test, so could we understand what it means? The most important thing of our biomedicine training is we want to produce safe practitioners, and I'm talking from my own experience. I'm not saying I did everything right, no, by far not. I did learn my lessons, and that's why we are very strict in our biomedicine training. So you study so-called red flag symptoms, meaning if a patient comes with a certain particular symptom, alarm bells need to come up, and you've got to send the patient to a specialist clinic, to a hospital, to a doctor, to whoever. But if you don't understand such symptoms, you sometimes look very simple. If you don't understand it, what we call, you are a danger to your client. And you don't want to be a danger to your client. So that's why this training is basic, and it's a must for each single practitioner, no matter what you study. You want to be safe. You need to understand certain things. Let's say, for example, pain coming up here. Alarm bell needs to come up straight away, and you need to send this person to a specialist, or a medical doctor, or hospital, etc. All right. Out of our biomedicine, as talk about the immune system, and that we present 2 religions, if you like. One developed by Louis Pasteur, French scientist. He put a so-called germ therapy together. According to Pasteur, he said, well, if there's disease, there's a bacteria or virus. Bacteria or virus are the cause of disease. And then there was a colleague of Pasteur who practiced at the same time, Deschamps. He said he developed another different therapy, which is a theory, which is called the Terrain therapy, the environment therapy, if you like. And he's saying, well, bacteria and viruses are actually not the cause of the disease, they are the result of the disease. And when you have bacteria, then they can only function if there is the environment, if we have the environment for bacteria to be alive. I can give you an example. Let's say, as I said, I live in Florida, it's humid, hot, fantastic environment growing for mold, for insects, for bacteria, or if you don't clean your house, or your body, you create an environment for bacteria. So that's the reason why they're there. Say, great, fantastic. I have food to live on. You know? But the similar situation you have internally in your body. If if the body is full of junk food, too much sugar, and damaged maybe by too much antibiotics and drugs, etc., etc., then you created or the client created an ideal environment for candida, for bacteria, for viruses, etc. Okay, so I believe there's some truth to what Mr. Bisham is saying. We work around this environment, strengthen the environment, strengthen the immune system. We know that 70% of the immune system sits in the gut. So that's why you need to clean your gut from time to time. You do this hopefully properly during Ramadan. I know it's very often done, in my opinion, I think wrong. You don't eat the whole day, but at night, you
Exactly.
give it to your body, you hammer
How do you say that?
or some people
Subhanallah.
eat. Now, that's not quite as it should be in my
حتى
opinion.
pesticides. حتى
We
junk.
should eat as little as possible, not as much as possible. Eating at night might not be the best for your overall health. So I'm a great believer in fasting and detoxification. Actually, it's a big part of our training, especially in nutrition. And also it's important to strengthen the immune system. Okay. Most of lymph nodes are sitting in the gut, so you want to clean this from time to time. I've written actually as a homeopath, I had a fantastic lecture, but he said, whatever the body puts up, whatever disease the body develops, there's always a remedy for it. And I said, wow, that's great. That helps me a lot, because I love sugar, I love chocolate, I love ice cream. But I developed a very quite. A patient came in my clinic saying, read this book. It was detoxing cleanse yourself, looking at my belly. So sometimes patients know more than a practitioner. So I didn't like it too much, but at the end, I did read the book overnight. I ordered a set of foods next day, and I put myself on fasting. And I did the worst ways how to fast. You know, on the training, there's water fast, there's vegetable fast, there's food fast, whatever. So intermittent fasting, which is a very good fasting to start with. So I put myself on a fasting. I felt never better than before. And then I tried more and more extreme. Basically, whenever my wife went on holiday or seeing family or leaving me for a couple of weeks or so, I emptied the fridge, bought a case of carrot juice or other juice, and I just drank. The longest time I fasted was 5.5 weeks. And this was actually the time where I wrote a book about fasting, about other things. I had so much time. I stopped sweating. I slept at the end only 3 hours a night. I didn't need more. I was full of energy. And I didn't feel I need to wash myself in the morning. Why do you need to wash yourself? To wash up the toxicity, the thing, the body gets rid of overnight. That's what you wash off in the morning. That's why I take a shower and etc. I felt super clean, and I had a lot of energy. So at the end, I started to write a book, and I'm a great. I know the power of fasting. I know the power of food. It can go both ways. If you eat too much and junk food, then it's basically not good for the body. All right. So let's take this a little bit further. Yeah. All right. So I did read a couple of books.
Video.
On the top, it's a cross-section of a clean colon. The other picture shows colon wall, cross-section of the colon wall with stagnant waste material on it. So people, or the colon, builds up stagnant waste material in the colon or in the small intestine. And the more of the stuff you have, the more energy it takes, the more life energy it takes from your body. The more tired one would get, the more coffee one would need in the morning to wake up. And it has another effect which I can show you in a minute. Yeah. All right. Now let's assume you have a build up here around the colon wall. This is a reflex zone of the reflex shaft of the colon, which shows connections between certain parts of the colon and body functions. So if the colon is irritated in certain areas, it could have a negative effect on any organ. It could be the heart, it could be liver, it could be kidney, it could be joint, it could be. I had a lower back problem, and I did a colon cleansing program. One day I passed a lot of stuff out, and I could feel the energy from here in my colon going to the back side, and from then on my back bone was solved. This was 30 years ago. It never came back. All right. So colon cleansing, fasting, enemas, all this stuff is very, very intuitive. All right. Now let's talk about the nutrition training. The nutrition training as such. So we cover biochemistry, we cover all the vitamins, minerals, spices, foods, etc., superfood. We talk about supplementation. Supplementation are very powerful. They are needed sometimes to start a treatment. I'm not a great favor of supplement, but sometimes they're very, very, very beneficial, no question about it. And then we talk about detoxification, about herbs, spices, sports nutrition. The strength of CNN is certainly that whatever we do is very practical, very hands-on. We deliver the highest number of clinics, you could say. At least 200 clinical hours in nutrition, 400 to 500 hours in the other discipline. Right. Most of our students, especially from the Gulf states, all our students from the Gulf states are taking our online training. Now, I know by talking to other people, most of you, a lot of you like in class. I'm a fan of in-class teaching, but we can't run in-class everywhere. So that's why we developed online. And online, actually, 70% of our students are online, or even 80% now. We do even case taking, supervised case taking online via Zoom. So where actually you are in your at home, in your environment, take a case, and that's supervised by a practitioner, and for the entire case taking. Then we send it in and work it out and follow up with client, etc. And then at some stage you get a pass. Yeah. So it is working quite well in herbal medicine, in nutrition, but also in acupuncture. Right? Acupuncture, obviously, you can't, practically you do in class. Now, I don't have, as far as I know, an acupuncture student in Kuwait. But should there be somebody interested in studying acupuncture, it's basically very simple. You can do all the theory online. We have phenomenal videos, high quality videos, especially in acupuncture, but also in other discipline. And then we can allocate a practitioner, qualified practitioner, acupuncturist, a Chinese practitioner, who will do all the practical with you in class, in the clinic, in Kuwait, if that's of interest for somebody. All right, so who's interested to study, by the way? Anybody interested to study? Oh, a couple, otherwise I can go home. Okay, you make me stay, that's good, thank you. Okay, so why do you study nutrition with CNN? Number one, we have the naturopathic approach. We focus on food, on the importance of detoxification. We use all herbs. We have a lot of clinical practice. We are practitioners, we train practitioners, not scientists, not philosophers who don't know how to take a case and how to go about it if there's a certain condition, etc. That's not what we do. We are very practical. Being an engineer myself, you do things which work. Because we are very much hands-on, very much practical, we have a success rate of about 80%, meaning 80% of our students or our graduates are actually practicing. We have done surveys twice. The numbers are a little bit higher, 81, 82%. So they're actually practicing. And if you compare this with many other training providers, that's why we are number one, because we have a top figure. If you compare it with other training providers, 80% are not practicing after graduation. So, so we are pretty good. All right. Yeah, so as I said, once you have done the nutrition training, then you can upgrade if you like, if you need, if you want to degrade. Now, let's have a brief look at herbal medicine. Who's interested in herbal medicine? Herbal, fantastic. Herbal medicine, great. Herbal medicine is very, very powerful. Because I think the best herbalist in the world, Peter Jackson Main, you saw the video of him. He got, I don't know, 50 years, 60 years experience. He's an epidemiologist as well. Now, similar structure as nutrition takes 3 to 4 years, depending on how you combine modules. We focus. That's what you. Okay. Yeah. So the difference between our herbal medicine training and some other herbal medicine training, we use organic whole herbs as stuff. We consider a symptom not as a disease. We try to find out what's behind it, what's causing it. We strengthen the immune system. We strengthen organ functions. And the advantage, I believe, studying this course, you are not just a herbalist, but you know of other therapies as well, such as iridology, pulse diagnostic, tongue diagnostic, facial diagnostic. So you basically see sometimes within a fraction of a second what's wrong and where you need to focus on the client, no matter what disease or symptom he is coming with. You know, I have a client, she had migraine since childhood. And we started with many cause, food poisoning, drug, medication, accident, nothing, but it started about around 14, 15. So, okay, what's happening? This woman, this time. So, cycle started, and the body didn't balance it or couldn't manage it somehow. So, let's say you see a normal practitioner or a doctor, and she has seen everything you can think of. All the guys, all the experts, top names and all of that. Then she came to me, which was beautiful. So that's what I meant before. Try to find a cause. What's the root cause? Where did it start? So in that way I started therapy. I used homeopathy, I gave homeopathic remedy, and she started to recover. She had all sorts of problems, only migraine, but stomach ache, and I don't know, there was nothing which really worked properly. But it started at this time, the body got out of balance, the body couldn't transition in an adult life somehow. So it has to do with hormones and all of that. But she's on recovery. This was, I took the case a couple of weeks ago, two months ago, so I'm curious to see how she's developing. All right. Okay, so, yeah, so that's what we do in herbal medicine. So why to study herbal medicine? As I said, we use herbs, use other diagnostic tools, and our focus is on clinical application. Now, as I said before, naturopathy is part of our herb training, acupuncture training, and homeopathy training. There are a couple of modules. We teach first aid homeopathy as part of it. And I believe there should be no practitioner who doesn't have at least a basic understanding in first aid homeopathy. You can use this on yourself, on children, on cats, on dogs, on pets, on camels, on horses, on anybody, on any living organism, including plants. I give you a little example. So I'm traveling since a couple of weeks. Got a call from my wife saying the cat has been beaten by another cat. What am I doing? So it's very simple. If you have done this training, the number one remedy is arnica. It absorbs the bleeding, the bruising. That's number one. And then the other is, well, now it's pussing, it's infected. Infected. Okay, pus coming out of the wound. So the next remedy would be silica. Silica to absorb the pus and heal the wound. So luckily it's closing and getting better and better, and Philo is out chasing cats again and they're happy. Okay, so that's first aid homeopathy. Or I can give another extreme example. When I practiced in Germany, I had a client, elderly client, who got wounded in the war. He had a metal piece, and his leg got removed. The wound got infected. There are a number of things you can do using herbs, acupuncture, etc. I'm a homeopath, so I use homeopathy. So the wound got infected. He got a lot of, it was in hospital, antibiotics, and was diabetic, and 80-something years old. And I had his wife coming to my clinic with something else, and I asked, okay, what's happening in life? And she said, oh, my husband is passing away, there's no chance. And I said, well, that's beautiful, I thought. I like such cases. So I took my assistant, went to hospital, we did a muscle test, which remedy to give. We gave him a remedy, particular remedy. To cut it short, he recovered within a couple of days. They took him off a antibiotic trip. The wound started to heal. They released him. They didn't know what happened, and he continued to work another, I don't know, 10 years or something. So, or any injury, any fall from a tree, from a table, baby had get injured, you need to know first aid homeopathy. You have an accident. When I travel, I always have two remedies with me. One is arnica for injury, for bruising, and one is aconite for a mental shock. And I can tell you lots of stories about that. Okay. Another powerful, beautiful therapy is Bach-Flower remedy. I use Bach-Flower remedy whenever there's stress involved. Exams, let's say when you give a lecture like like that, the stress, the heart goes. Some people run to the toilet, diarrhea, or in a perform, in sport. There are different ways people react. So you can, using Bach flower, energetic medicine. So it's an energetic problem. It needs energetic medicine. So I use Bach flowers to balance the stress situation. I give a Bach flower remedy to, let's take, give another example. We have in Florida every year hurricanes. And one day my wife came in and said, well, our trees, bushes are dying. And so, wow, yeah, that's right. They chopped all the leaves and etc., etc. So they were under a shock. The energetic living organism were under shock. Bach flower is an energetic medicine. So I gave them a Bach flower remedy, and within a day or two, they recovered. Another extreme situation, this was in Italy. There was a late frost call where olive trees died, which is a big problem for farmers. So they were under shock. There's a remedy called a rescue remedy, and that's what you give. And that we put this in water, and water olive trees, most of them recovered. Any stress situation, shock situation, after accident, after bad news, after surgery, etc., need our rescue remedy. And then there's another beautiful therapy which is called tissue salts. Remember the story I told you when my bones didn't want to melt together? There's a tissue salt, calcium phosphoricum, which helps to melt the bones together. I have a friend of mine, actually a friend of my wife, she's sending me all her friends. She had hip surgery, so dealing with bones and difficulties to grow together, etc., colors, etc. There's a particular remedy it's called calcium phosphoricus, which supports bone growth. In Germany, it's been invented by a German homeopath, Bach tissue salts. In Germany, you can use tissue salts to improve any body function. It's sometimes people specialize in let's say, in beauty, if you like. You know, women, men want to look nice and beautiful. You look in one's face and say, well, there's a particular remedy missing. You can diagnose this, you can diagnose what remedy is needed, what tissues all is needed. In over months, the person or the wrinkles, the symptoms, the dark shadows, whatever it is, would disappear after a couple of months. Isn't that beautiful? So you don't need Botox and all this crap. And no surgery. The body gets all of it, nothing you can do. If you have signs or lines, etc., it helps us to diagnose, and then we will start the right tissue salt or whatever it takes to balance body functions. And then, of course, we have iridology as part of the naturopathy training. Iridology here, we have different irises. That's what you magnify. Depending on the structure of the iris, depending on the color, depending on particular signs, you can diagnose, you can see basically what's potentially wrong with the sign. And we know from experience that a carrier, let's say, of beautiful blue eyes, they tend to certain conditions. If they come with a joint problem or a migraine or etc., you would treat them in a certain way to support his immune system. Okay. Now, being in the Arabic world, we all have beautiful dark eyes, which is a bit of a challenge to diagnose. But if there's a health problem, let's say diabetes or you name it, then we know from a practitioner, as a practitioner, what you need to focus on in order to overall improve the situation of the body. And that's mainly liver or blood building organs, spleen, liver, mainly. So, and that's why you need, if you're carrier of dark eyes, and most of you are, I guess, then you don't need sugar, which is a poison. You need bitter food to stimulate gallbladder flow. A bitter salad, that's what you normally have in the morning. You start a meal, you have bitter stuff, or bitter herbs. Okay, so you can see this by doing the pupil gives an indication on how stressful the person is, what organs are affected by being under stress. Or let's say, again, somebody comes with a headache, you look in the eye and you say, well, actually headaches is not a problem of the head, which is very often the case, it's a problem of the digestive system, or the lung. You know, somebody comes with a lung problem, asthma also, you look in the eye, say, look, you see, well, the lungs are actually strong, they're good, there's a weak kidney function. So you, as a Chinese practitioner, take a pulse diagnostic and you see what's wrong basically. As a naturopath, you do radiology, you see what the weak point, the weak spot is, and then you can treat and strengthen the weakness in a person. So that's totally different from, I would say, a normal approach in medicine, isn't it? All right. So that's our training in herbal medicine. Acupuncture has the same structure, it's a 3 to 4 year training. You can study online, as I explained. Then, unfortunately, we don't offer homeopathy training online yet, but it is coming. Now we have another brilliant training, that's a health coach. Health coach consists of 5 modules. We first teach how the body works. It's a foundation of basic course. So you study all the body functions. Then you study a little bit nutrition, basic of nutrition. Then there's another module which is coaching and fitness. All right. So, luckily I had the pleasure to contribute to this lecture, and I contributed to the fitness module, and I didn't like sport myself, but after writing this, I started to go to the gym and run and do weightlifting, all that. And guess what? I felt much better, much healthier, much more energetic. So that's why we put fitness and health in each single training, but especially the health coach training. They learn basics on how to improve your overall health. Nordic walking, for instance, that stimulates your lymph flow. So, and therefore it has a very positive effect on your thyroid function. Okay. What else? Part of our health coach training is obviously part of the training is we talk about business, how to build a business. Most of our students, they're good people, of course, but very often they don't know how to build a business. What are the basic tools how to build a business? Where do you start? There are 2 important elements for a practitioner, I believe. Number 1, you need to know your stuff. Number 2, you need to have some business skills. If you don't, then you have only 50% of your possibilities. No, you're less successful at the end. So we teach how to create a business. You first decide who is your target audience. Then you create your own database. And then you need to learn how to run a business by statistics. You learn how to do service. You're going to find out what is your public looking for. What are the questions? And then you would offer that. All right. You can study this online or in class. Do here. Okay. So CNN has been around for 26 years. We are well recognized, well accredited throughout the world. Depending on trading in North America and Europe, and we got our accreditation in Dubai recently. So it's pretty safe, especially when you're traveling, to have CNN qualification with you. That's one reason more why more and more students are enrolling in our training. But I leave you with that. It was an absolute pleasure talking to you, and I highly recommend for further questions, talk to me, talk to Bobby, our education director, or to one of our course consultants. And I see you back in Kuwait. I will come back to Kuwait and I'll tell you when. It's in January, and I'm not telling you what's happening, but it's going to be something very special, big. I can tell you so much. And I'd like to see all of you on course in training. Thank you for listening. Thank you for your time.
Any questions?
Thank you so much, Andrew.
Mahfoud.
So, I think, although we can't say too much about what Herman just said, I would like to play this video, which may in some way be relevant.
Barbara O'Neill, and I'm answering the question, why study the College of Naturopathic Medicine? Well, as you probably noticed, I'm getting old. Soon, I will need to ease out of this. I'm in my 70s now. I feel great. And I feel great because of the way I live. And that's exactly what the College of Naturopathic Medicine is all about. Teaching people how to look after their bodies. We need more teachers because the world is sick. The world is crying out for answers. And a lot of people are discovering that medicine may certainly play a role in the process, but it's not healing. There's only one thing that can heal, and that is the human body when it's given the right conditions. And that's what the College of Naturopathic Medicine does. It's teaching people how their body works and how to bring about a healing condition in the body. So I'm so glad for this college. It's needed today. Hi, I'm Barbara O'Neill.
I better not say any more, otherwise I could get into trouble.
I'm Barbara.
So I will stop. Okay, thank you so much for sitting around and listening. We're now going to have about a 20-minute break, and then I will be delivering the next talk. The next talk is all about